The actions that are being taken are necessary. As we look around the world, we know what's happening, and we know that we have to be cautious. And the great gains that have been made at great sacrifice and at great cost over the course of this year, we intend to maintain them. And that means that in circumstances like this, as we have done so now on many occasions, we need to act swiftly as is occurring, as the authorities get on top of this and ensure that we can preserve the gains and ensure that we can go into 2021 in a good state. The virus, as I've often reminded everyone, it doesn't go anywhere. It's still there. It's a global pandemic. And as a result, outbreaks will occur from time to time. Remember the Crossroads outbreak, Northern Tasmania, Adelaide just a few weeks ago, of course what occurred in Melbourne. Even smaller outbreaks have occurred in Brisbane and in many other places. It's how you respond to the outbreaks that matters. The outbreaks are things that are going to continue to occur. And while great care is taken all around the country, then we can never fully rule out that an outbreak might occur at some point in time. In this case, what we're seeing is both great cooperation, as we've seen in other places before, but the geography, I've got to tell you, is helping us as well. Those of you who know Sydney well know that the peninsula is a very cohesive and a community that tends to keep to itself, a bit like the Shire, down where I'm from. And that is certainly, I think, assisting in making sure that the Avalon outbreak is staying exactly where it is. And the Premier has already gone through at great length with the Chief Health Officer in New South Wales about where things are today. But we do welcome the fact that we've seen a reduction in those new cases in that 24-hour period. That's no guarantee of tomorrow or the next day after that, but it is certainly much better than the alternative. And as we go into these next few days, we'll be watching carefully as we endeavour to understand whether there's been further seeding, if there's been any seeding, I should say. There hasn't been any at this point in other parts of the city or other places. And I'm sure Professor Kelly will make this point as well. If you're from that affected area in the Avalon outbreak in the northern beaches of Sydney, if you were there over the past fortnight and you happen to be somewhere else now, if you're in Adelaide, if you're in Queensland, if you're indeed here in the ACT or somewhere else, then the rules about isolation apply equally to you as they do to those of your neighbours who are back in Avalon and the northern beaches right now. And I think that's a very important point, and we seek people's cooperation. I think the speed at which the New South Wales authorities have been able to get on top of this and understand the extent of the community transmission in all those places has been outstanding, and that is greatly assisting them in managing this outbreak, and that will continue. I should note, as Professor Kelly did on Friday, that the Avalon outbreak does qualify under the national hotspot definition, and that's been the case for several days now. And so therefore the precautionary actions taken in other jurisdictions is understandable in that context. Let's hope that they won't be required for long. Let's hope that what we see here in New South Wales, and I think there's good cause for that hope, on what we're seeing, having just spoken again to the New South Wales Premier this morning, there is good cause, I think, to have hope that if they continue to apply themselves in the way they are and the cooperation continues, then we can hopefully see things return to COVID normal as soon as we possibly could hope to see that occur. One of the very encouraging elements of the response so far has been the community response, with some 38,000 tests conducted yesterday. That's a record. What that shows is people are listening and they're coming forward. All of those test results are incredibly helpful to the authorities as they get on top of this and manage to map the impacts of this community transmission. We're already seeing that some of those who are identified as having the virus were already in isolation. They'd already isolated themselves as a result of the precautionary approach that had been advised by the health authorities. And that shows you that the system is working. The turnaround on testing, same day, we will know of anecdotal evidence of people getting turnarounds and tests in a number of hours. For some, it's taken a bit longer than that. But the same-day turnaround, the ability to ensure that they're running tracing to ground within those 48-hour periods, these are key metrics that are being hit and very essential to the response. Just quickly on the issue of aged care, there are no cases in any aged care facilities in these affected areas. In fact, there are none in the country. There is one case where there was a visitor, but I'm advised that that visitor was wearing masks when they were visiting that individual, and at this stage there is no suggestion that there has been any virus infection at that site or any other sites. That said, we have put in place the single site working arrangements and support for the facilities in the affected areas. In addition to that, we're also doubling down on the support provided for PPE and other supports through the aged care facilities to ensure that those facilities on infection control and the other matters are being well attended to. I've already mentioned the testing on the Commonwealth-funded GP respiratory clinics. All across New South Wales and the ACT, we've agreed to a request to allow asymptomatic testing, and that will continue for as long as it needs to. That testing is proving also very helpful with New South Wales authorities on tracking the course of the community transmission. In defence, I should note that we have some 1,298 Defence Force personnel who are deployed to supporting our priority, which is hotel quarantine. That includes 342 officers in New South Wales, 284 in Queensland, 150 in Victoria, and the other numbers I can make available to those who are seeking them. Some 1,600 ADF personnel are directly involved in the effort all around the country. We will be providing, in response to the request, some additional logistics and other support to the Victorian Government to support their border operations, but that does not extend to actual patrolling of the borders. That's not something the Defence Force is doing any longer. That will be done by state officials and supported through the ADF with their logistics and other planning experience. But our major priority for ADF is actually on the hotel quarantine, and that's where I think we can add the most value, and that's certainly the view of the ADF and General Fruin, who is responding and assessing each of those cases. I also note that the pandemic leave disaster payment for those who are in New South Wales and having to take tests and have to isolate themselves, that continues to be available. Some $18 million has been paid out in that payment since it was first introduced to Australians and Australian residents. 16 million of that, I note, was actually paid in Victoria. And so in New South Wales, for those who need to access that payment, they can access that payment, and hopefully that will be of great use to you. The only other thing I was going to note today was that tomorrow's swearing-in ceremony we will be doing virtually, bringing people from around the country to the ACT, including from Sydney. We don't think it's a wise decision, and so alternative arrangements have been made with the Governor-General, and we will arrange another suitable time for a formal ceremony later in January, but the official swearing-in to enable those changes to the ministry will take place tomorrow, and those arrangements will become active after that swearing-in. So with that, I might pass over to Professor Kelly.